Good morning. My name's Wendy Frost and I'm the Domestic Violence Educator with the Education Centre Against Violence. So thank you for joining me this morning. I've been asked to present this webinar by NADA for their participants. So I warmly welcome you all into our virtual training room today. Okay, so the webinar today will be on responding to domestic violence when working in alcohol and other drug settings. As we start, I'd like to acknowledge the traditional owners of the land on which we are all sitting. I'm blessed to be sitting, living and working on Darrick land. So I pay my respects to all Aboriginal people, to all their elders, past, present and future. And I warmly welcome any Aboriginal participants into our training today. So due to the internet difficulties that we may experience today, what I'm going to do is to provide you with a Vimeo link which will allow you to watch the presentation through the Vimeo link, and you shouldn't have any problem with distorted slides, etc., which is an experience that we've had previously with pre-recorded webinars. So hopefully you're all on the link now and that we can proceed. Okay, so the focus of the webinar today is domestic violence, and we will be touching on COVID-19 as it continues to be very active within our communities. We'll be looking at screening and domestic violence, and then we'll look at responding effectively. We will touch on safety planning, and I will be explaining a lot more in regards to safety planning as we go through. And we'll touch on referrals, where to from here. So there'll be a little bit of homework there for you in regards to referral pathways. And then I will look at additional training. Given the short time the webinar is running for, so we have 45 minutes of presentation, and then there will be 15 minutes questions and answers at the end. We are strongly encouraging additional training because we are very much only going to touch on subjects today. A little bit about the Education Centre Against Violence. So we have a range of portfolios. So if you jump onto our website when you have time and have a look through our range of portfolios and the different areas of training that we provide. I want you to think about self-care as we join together to discuss domestic and family violence. So if you're feeling triggered or upset by any of the content or materials provided during the webinar, we encourage you to use your discretion as to whether you should continue reading, watching or listening to the material. So please think about your self-care strategies before we continue, and think about who you may be able to contact should the need arise. We will be using gendered language throughout the webinar today. We refer to victims and survivors as women and children, which reflects the evidence and the statistics, both national and international. And we do know that domestic violence is predominantly perpetrated by men against women. However, women can be perpetrators of violence in both heterosexual and LGBTIQ relationships. So the National Plan to Reduce Violence Against Women and Their Children 2010 to 2022 identifies domestic and family violence and sexual assault as gendered crimes that have an unequal impact on women. And I do want to say there, we do acknowledge that men can be victims of domestic and family violence, but again, we are in our training reflecting what we know from the data and from comprehensive research. So what's the purpose of our time together today? What we know is that specific skills are required to address domestic violence. So this webinar does not suggest that all AOD workers should take on a role in comprehensively addressing domestic violence. We want all AOD workers to have an awareness of domestic violence issues, knowledge of their organisation's DV policy and procedures, and the ability to respond sensitively and appropriately to DV issues, and a capacity to provide a basic response. And we will be looking at your referral pathways and ensuring that you know what your referral pathways are for your organisation. So this model here is what I based the training on when I thought about what we were able to do in a short period of time that was going to be helpful for participants. So I'm really focusing on level 1. So the basic, for the practitioners' responses, so the basic awareness of family and domestic violence, knowledge of your organisational policies and procedures, ability to respond sensitively, and access to supervision debriefing as needed, and also somebody to share the risk with. So that's the level that today's information will be aimed at. We do move up a little bit into the next section there where we will touch on safety planning and again referral processes. So what is domestic and family violence? So the term domestic violence usually refers to violence against an intimate partner or ex-partner, while family violence may include violence perpetrated against children, older people, against parents by children, and other kin or family members. So many Aboriginal and Torres Strait Islander communities prefer the use of the term family violence to reflect broader family and kin relationships involved in violence. So there is no single definition, but the central element of domestic and family violence is an ongoing pattern of behaviour aimed at controlling a partner through fear, for example, by using behaviour which is violent or threatening. And in most cases, the violent behaviour is part of a range of tactics to exercise power and control over women and their children, and can be both criminal and non-criminal. We know that there's many types of domestic and family violence, but all forms are characterised by behaviours that are intended to coerce, control, and or create fear within an intimate or familial relationship. All domestic and family violence is considered emotionally abusive. So we look at physical violence, sexual violence, psychological abuse, coercive control, social violence, financial violence, spiritual violence, and technology facilitated violence. So these points here are from the National Risk Assess Principles developed by NROS in 2018. Let's have a look what the data is telling us. So when we look at the information from the Personal Safety Survey of 2016, where they looked at physical violence by any type of perpetrator. So 3 in 10 women of respondents and 4 in 10 men experienced physical violence of any type by any type of perpetrator. So we note there that men have higher rates of physical violence by any type of perpetrator. Let's take that further. Physical assault by a male, gender similarities. So the most common experience of violence for men and women was physical assault by a male. So in the most recent physical assault by a male in the last 10 years, let's have a look at some of these statistics. Approximately half of the women victimised perceived alcohol or other substance to be a contributing factor to the most recent incident. And 2/3 of the women victimised did not contact the police. So I think that's a really important statistic to take note of because in the work that we're doing, we need to acknowledge that 2/3 of people are unlikely to make contact with the police. So it really shines a light on how important our role is as working in the community services sector. 2/3 of the men victimised perceived alcohol or another substance to be a contributing factor to the most recent incident. And 2/3 of the men victimised did not contact the police. So again, they're quite high statistics and a lot of unreported matters. So when we do look at statistics, we have to take that into account, that a lot of domestic and family violence and physical violence is not reported to the police. Violence by an intimate partner. So 1 in 4 women experienced violence by an intimate partner, and 1 in 13 men. We do need to know high risk factors for domestic and family violence. So it's really important that you take away from today's training knowledge about the high risk factors. So things that to take into considerations, things to be aware of with the families that you are working with. So if there's been intimate partner sexual violence, there's been a history of violence, non-lethal strangulation or choking, separation, so if there's been a recent separation or separation is imminent, or within 12 months of separation. Acts of stalking. Has there been an escalation or frequency and or severity of the violence? So you may hear that it was violence was being perpetrated through verbal violence, lots of yelling and putting down and acts like that, where there's been an escalation. So now you're finding that, you know, it might be a slap, or it was a slap previously, whereas now it's closed fist. So just taking note of those escalations. Has there been or is there coercive control? Has there been or is there threats to kill? Is there misuse of drugs or alcohol? Is there pregnancy and early motherhood? Because again, we know that they are high risk times. Many women report an escalation of domestic and family violence during pregnancy, or that is actually when they first experience domestic and family violence. Is there court orders or parenting procedures before the court? Thinking about the victim's self-perception of risk. They know their situation best. So if they're seeing that there's a change, that the risk is escalating, we need to take serious note of that. Does the perpetrator have access to or use weapons? So they may be registered or unregistered weapons, but you may have knowledge of that. Has there been suicide threats and attempts by the perpetrator? Has there been abuse of pets and other animals? So we know if there is harm happening to animals or animals are being killed, it is a really big red flag. So please take note if you are hearing stories of animals being harmed. It is a strong indication of future lethality within that family. Is there isolation and barriers to help seeking? So if you're concerned for a partner of a client that you're working with, but you know you're finding that they're being isolated more, you're having less opportunity to see them, hear stories about them. So there's a change happening there as well. So what have we got in place to assist with what we know in regards to domestic and family violence? So we have the National Plan to Reduce Violence Against Women and Their Children. It was developed in partnership with all states and territories and endorsed and released by COAG in February 2011. So in your pre-reading package, you have got further information in regards to the National Plan. So I won't go into that any further now. The New South Wales response, again, you do have further information in your package, so please take some time to read through that. It's important that we know what legislation is there and what's been put in place to address the national response. So if you are viewing from another state or territory, I encourage you to access online the information and make yourself aware of what is in place within your area. There's links there to both the national and the New South Wales response, but as I said, I've also included that in the pre-reading package. Let's touch on COVID-19 and domestic violence. So what do we know? As with the information in regards to COVID, things are changing each day. We're learning more, we're finding victims and survivors reaching out more. Some are being isolated more. So there's a whole variant of what we're seeing and what we know. But what we do know, it's causing significant financial hardship, isolation, anxiety and stress, and it's creating an environment of heightened risk for family violence. We know this because there's an increase in isolation in the home, and new cases of family violence may be more likely with the significant strain on families. Women's Safety New South Wales, this was from information that they released in March this year, so they're continuing to put out information that you can access online if you're wanting further information as to, what's actually happening in regards to the experience of victims and survivors, specifically around COVID-19 and the restrictions. So the key findings of the information that was gathered by Women's Safety, 41.9% of specialist services reported an increase in client numbers. 47.6% reported an increase in the percentage of high-risk cases. So what we know is that women were reaching out when the violence had got to a higher point. 43.9% identified women reporting that violence and abuse escalated during the lockdown. 61% identified women reporting that it is harder to engage with services during COVID-19. 41.5% reported more women planning to escape the violence. 39% reported women still finding it hard to engage with services safely. And 36.6% reported women prioritising material needs and concerns over their own safety at this time. And 29.3% reported insufficient service availability. So it's had a huge impact on what services are able to do, but also what victims and survivors are able to do in regards to helping or seeking help. So the federal government released data showing 11% increase in calls to the 1800 Respect helpline, 26% rise in calls to Men's Line, which provides specific counselling service to men struggling with emotional health and relationships concerns. And there was concerning statistics from Google, which was seeing a 75% increase in searches about family and domestic violence compared to the average number of searches over the previous 5 years. So definitely some concerning data, and this is, as I said, only the data that we know so far. Whenever we're looking at domestic and family violence, we need to consider safety. So I want you to think about safety first in all the interactions and actions that you take. The safety and well-being of women and children needs to be your priority. So even though women and children may not be your clients, what we're saying is that you can be an advocate for them and act on their behalf. So you need to consider, what is your role? What is your position? What are you able to do? but please consider safety in whatever actions that you are going to take. So is what I'm doing making it safer for the person experience violence? Are you able to talk to the victim? Is it safe to do so? Is the person using violence in the room? So if you are using technology to speak to a victim of violence, do you know that they're in the room by themselves? Do you know if it's safe to talk to them that way? Do you know if the perpetrator might be listening in? Are they somehow monitoring the conversation? So it's all of these considerations that we really can't do justice to in our short webinar today, but it's about starting to think about these things as you take away the information that we provide you today. In case of any imminent risk, we are going to encourage you to ring 000 for immediate assistance for families. So if we think about, again, what is in your role? Are you able to talk to the victims? Where is the perpetrator? All of that information, again, I want to bring forward to the front of your mind. If you are able to safely talk to a victim, some of the questions that you may be able to think about and start a conversation with. So these are from the Australian Institute of Family Studies. Do you have any reasons to be concerned about your own safety or the safety of your children? Do you have any other concerns about your children's well-being at the moment? Or do you have any reason to be concerned about the safety of anyone else? So there's some of those soft entry questions that may just start a conversation. Some of the indicators of domestic violence in adults. So I'm not going to go through all of these. You will have access to these slides, which will allow you time to actually read through some of these indicators, which will just help you to start to recognise or start to think about domestic violence. Is what I'm seeing, is that raising my concern? So please take some time to read through these slides. Again, the adolescents experiencing domestic violence may not be your direct role, but what we want you to do is to see and hear children within the families that you're working with. Another slide for children experiencing domestic violence. Again, I'm going to say it, children are quite often invisible within families. We talk about perpetrators of violence being invisible, but often, sadly, children can also be invisible, and their experience of violence and their experience of living with domestic violence is quite often missed. I have touched on child protection and your mandatory reporting of child abuse and neglect. Domestic and family violence does sit under your mandatory requirements. So please make yourself aware of what are your requirements in regards to child protection. Again, for people participating from other states and territories, please be aware of what is in your responsibilities in your state or territory. New South Wales participants, you can certainly access the mandatory reporter guide. If you haven't done your child protection training and you are working with the whole of families, I strongly encourage you to jump online or to access some child protection training. You can also go on to the mandatory reporter guide and have a look at that, have a play with it, get familiar with it. So let's go back to responding to a disclosure. So if you are working directly with the victim or you have had some contact with the victim and you've received a disclosure of an experience of domestic and family violence. So again, I bring you back to focusing on safety for the client, their children and service staff. So is what I'm intending to do making it safer, or am I escalating risk for the client, their children, and other service providers? Help them to protect themselves. Identify who else can provide support and how they can safely access information, websites and services. Listen, hear and believe. Take the abuse seriously. Emphasise that violence is always the responsibility of the person that is violent. Be non-judgmental. That's both in your use of language and also your body language. Build the client's self-confidence by acknowledging that disclosure takes a great deal of courage. So really, it's really important that in your responses is that you say, thank you for sharing that with me. Sometimes it's really hard to share our experiences. Help the client to think about what they want to do. Support their choices and timing, and maintain regular contact if possible, and negotiate when it is safe to call. So if you're intending on calling them back, you need to think about when is that going to be safe to do it. If the perpetrator or the person using violence was to answer the phone, you need to think about what is it that I'm going to say if they do answer the phone, because simply hanging up may actually increase the risk of the person experiencing violence. This is the information sharing for 16A and 13A for New South Wales. So if you are given information in regards to someone's experience of domestic and family violence, you need to be aware of how or when are you able to share that information. A lot of information on that slide, I'm aware of that. I have included that in your pre-reading package, but it's important for you to be aware of how can I share information, under what circumstances do I need to obtain permission to share that information. I will say it's always best practice to obtain clients' permission to share information, but there is circumstances where it may not be safe to, and the client is at serious threat. Again, we don't have time to go into that in any depth today, but please do some further training or research in regards to information sharing. 16A refers to Children and Young Persons Care and Protection Act, and 13A sits under the Crimes Act in regards to domestic and family violence. So if we look with safety planning, so again, we're really just touching on this today. So safety planning is a collaborative process between the victim and a professional. So it's working together to develop a safety plan. What you will find is women and children are already safety planning. They may not call it safety planning, but you will be tasked with, if this is in your role, to helping them put some greater depth into what is it that they're already doing. Is that working for you? Can we change that up? Can we make additional strategies within that safety plan? Recognise that the risks can change and escalate quickly. So what we find is if perpetrators are aware that the behaviours of a victim are changing, that then they will change up their tactics. So things will be moving all the time. What are they already doing to keep themselves and their children safe? Bring that to light. Just leaving is not always a safe option. Again, I refer back to one of our earlier slides around increased risk at times of separation and post-separation. Safety plans should be personalised, detailed, and outline a clear and specific strategies and measures that aim to improve the safety across a wide range of situations. So safety planning for when at home, when out shopping, when picking the children up. There's a whole range of different situations that need to be accounted for. At a minimum, a safety plan should list the contact numbers for family violence organisations, list emergency contact numbers, identify a safe place for the victim to go if she's in danger and how to get there. So that may be a safe place within the house. It may be a safe place outside of the house. Identify a friend, family member or neighbour who can assist in an emergency and how to contact them. Because in that moment of crisis, all that information may drop out of their mind. So it's important to bring that to light. Access to money in emergencies. So some women will actually hide money somewhere discreetly, or they may leave money with a neighbour. Or there's a number of different tricks and strategies that women develop. Identify a place to store valuables and documents. So that may be in the boot of the car, in the gym bag, or it may be at a neighbour's, or there are some domestic violence services that will help store documents for women. And think about barriers to implementing the safety plan. I have certainly given an example there of animals, because we do know that women are unlikely to leave if that means that they're leaving their animals in a place where they may well be harmed or killed. So you're concerned, what next? So there's things that you're seeing, things that you're hearing, and it's really raising your level of concern. Again, if there is immediate risk, call the police on 000. Talk to your manager. Talk to colleagues. Has anyone else had similar experiences? You know, there's something that's just not sitting comfortably with you. Share that risk. Talk to other people about it. Know your referral pathways, because this is not all in your role. So for some of you, you may well be working long term and it may sit somewhere in your role, but for others, it's not in the scope of your role. So you need to know your referral pathways and the processes and policies which sit within your service. Risk assessments. So we haven't covered risk assessments within this webinar, and we certainly won't have time to do that. But what we do encourage you to do is to know a service that is able to do a risk assessment. So for New South Wales participants, the Women's Domestic Violence Court Advocacy Service will be able to complete a risk assessment, and multiple other services within your area, domestic violence specialist services, will complete a risk assessment. So again, if there's things there that you're really concerned about and you can safely provide that woman or that victim with access to other services where a risk assessment can be completed, it's really important. But you need to know how to do that. You need to know your referral pathways. And think about your child protection, and really notice and hear the children within the families that you're working with. Working collaboratively across agencies is fundamental to improving the safety and well-being of adults and child survivors. So the safety of survivors and holding the perpetrator accountable are best achieved through an integrated systemic response that ensures that all relevant agencies work together on risk assessment and risk management in partnership with the survivor. So that again is from the National Risk Assessment Principles. So that is available online. Please have a look at those. Lots of really valuable information in an easy to read document. So please have a look. But it's important that we know who else is in our area, who is the domestic violence specialist, where are the family support services, who can I collaborate with in working effectively with the family. So seek advice. Again, it may be your manager, it may be colleagues, it may be interagency services, interagency meetings that you can attend and find out who else is in the area. Think about those referrals to specialist domestic violence services for casework and accommodation. And think about joint case management. Always have a lead within that case management, because sometimes things can get lost when we have multiple services working with families. It can actually escalate risk. But if you have a leader within that joint case management provision of service, it can work really effectively. So think about that. Think about men's behaviour change programs. Think about family workers within your area, legal services. Where can I get some advice? Who can I work with in regards to increasing the safety of the women and children that I'm concerned about? And think also about children's services. So that may be child protection. It may be the local preschool childcare centre if the children are attending. So it's other sets of eyes on those families. List of numbers there, again, for your consideration and takeaways. Again, I have provided additional contacts within the package that I've sent out. Don't forget the Kids Helpline, really important access for children to have additional supports. So caring for yourself, we always like to include caring for yourself, really important in the work that we're doing. So we want you to share the risk, talk to your manager, colleagues, DV services, legal services. Sometimes when we're working with families and we are concerned about domestic violence, or we've had a disclosure about domestic violence, it can weigh really heavily on us, particularly if it's well outside of our role. So share that risk, talk to people, don't hold on to that risk. Document, really important to document what it is that you've seen, what have you heard, what have you been told. When I talk about detailing acts of resistance, I haven't mentioned resistance throughout this training because we just don't have time to cover that. But what we know from the work of Michael White and more recent work by Alan Wade is that whenever there is acts of violence, there's acts of resistance. So what you might be seeing is actually an act of resistance. So we need to be able to document that. And again, I'm not doing justice to that at all. So please jump on and do additional training. But the acts of resistance are really, really important. And we need to learn to be able to document that, because the power of our case notes, you know, for those that have had case notes subpoenaed, it's really important what we're writing, the language that we're using, and how accurate our documentation is. Caring for yourself in team meetings, so review practices, policies and procedures. So do we have a domestic violence policy in place? How often are we reviewing that? Is it working for us? Are we able to follow through the steps that are included in that policy? Seek support for yourself. So again, through supervision, so that may be internal or external to your service. Think about EAP. Do you have access to EAP? Can you also access supervision in other areas? Talk and act on vicarious trauma and resilience. So vicarious trauma is real. In the sector that we're working in, we're hearing people's stories of harm constantly, so we need to be very aware of vicarious trauma and the impact that that can have on us as workers. We also need to think of resilience. So again, I haven't got enough time to talk through in detail resilience, but it's really important that, again, you do further research and training in regards to that. So finally, knowledge gaps. Want to know more? So I'm hoping so. I hope this has just really shot a light on domestic violence, and that you may well be interested in knowing more information. So we have a range of courses available. At the moment, all of our training is online, so you can access some short, sharp training. Again, we're encouraging people to come back to our face-to-face training, hopefully in 2021. Some of our courses are practical skills in responding to people who experience domestic and family violence. That's a 4-day training package. We've got domestic violence for drug and alcohol and mental health workers. That one is a 2-day training package. Domestic violence and child protection, developing good practice responses to a complex problem. So again, it's about seeing and hearing children. That is also a 2-day program. Working with young people in the context of domestic and family violence, 3-day training package. And skills in working with male family violence. So that is, they have a range of training available within our men's programs. So I think at the moment, they have 2-day programs, 4-day and 5-day programs available. Okay, so that's actually it for our training now. We will be available for questions and answers. So look forward to hearing in the chat box your questions. And Linda Andrews, team leader for domestic and family violence work, will be joining us for our question and answer time. Thank you.